Meantime, New York is one of a handful of states that's now declared a state of emergency due to the coronavirus. Governor Cuomo deploying the National Guard to New Rochelle in Westchester County, just outside of New York City, where more than 100 people have tested positive for COVID-19. New York City is also taking measures to try and mitigate the spread. Joining us right now on the Squawk Newsline is New York City Council member Mark Levine. He's also the chair of the Committee on Public Health. Good morning to you. Thank you for joining us.
Good morning, guys. Happy to be here.
So help us try to understand where you think this is in the city and what other mitigation efforts we might be seeing over the next, let's say, 72 hours.
You used the right word, mitigation. We are moving to a new phase here. This is beyond the point where we can contain individual cases, where we can track down patients and trace all of their contacts. It's out there in the general population. That's what we call community spread. And so we have to move to preparing hospitals for capacity and a spike, in case we have a spike of acute cases. We have to do more to protect vulnerable people, the elderly, people with pre-existing conditions. And we're going to have to move forward on social distancing measures. Right now, the only recommendation the city has offered is that older people and those with pre-existing conditions avoid large public gatherings.
Mark, are we moving too slowly?
We are moving rapidly in New York City, and I expect to see new moves in the coming days, maybe as soon as today. There could be a general recommendation for people to avoid large public events. Now, that is short of a mandate.
Doesn't that seem like it should have been made several days ago, if not a week or 2 or 3 ago?
All of these decisions have major costs. If we close the schools, hundreds of thousands of kids will have nowhere to get lunch and breakfast. Parents will be home providing childcare, unable to go to work. I've talked to hospital presidents.
You realize the mixed messages that this sends to the community. We're being told avoid large gatherings, but send your kids to school. Don't take the subway if you can walk, or if you can take a bike. But if you have to take it, go ahead and take it. I mean, it raises all kinds of questions, particularly when you admit that this is too late to contain and it's out there. What are people supposed to do?
Well, on schools, remember, kids, thank God, have largely been spared from this epidemic, and those that do get sick have pretty mild symptoms.
Mark. They're carriers, so the kids go home to their parents, and even worse, their grandparents, and then all of a sudden you have a real problem.
Yeah, the science on that is still evolving, but because every one of these actions has a real cost, it has to be taken by weighing the pros and cons and a real sober assessment of risk.
Mark, walk us through this. Here we are in New York City. Broadway, as far as I understand, is still open. Madison Square Garden is still open. Obviously, the subways are still open. Restaurants are still open. What are your thoughts on those? And to the extent that both the public and we're a business channel, so there's lots of investors out there that are trying to understand what may or may not happen economically, how should we think about it?
Well, look, our understanding is that transmission is largely through very close, sustained contact. That's why it's mostly in families. This is not like measles where you catch it just walking in the same room as somebody.
What about a stadium?
But as for, again, this is mostly transmitted by touching contaminated surfaces and touching your mouth. But as for the economic impact, it's going to be massive. It's already hitting, it hit Asian neighborhoods weeks ago. We've talked to businesses with revenue down 70% in places like Chinatown. Many are already closing. It's heartbreaking. That was driven by prejudice at an early stage of this crisis when there really was no risk. The city is now offering zero-interest loans and grants to small businesses, hopefully to stem the tide of closings. But we're a tourism-driven economy. That's obviously down. People are telecommuting, so they're going to spend less money at local restaurants and other establishments. This is going to be an economic shock for the budget of New York City, without a doubt.
What would it take for you to shut down Madison Square Garden or Broadway?
There'll probably be an announcement soon to recommend people avoid large public events. The mandated closure may be coming soon. We've had 36 cases in New York City, so we want to keep that in perspective. Health officials that I trust are evaluating this every single hour.
What do you think the real number is, by the way? Mark? What do you think the real number is? You said 36 cases in New York. What do you think the real number is?
If you were to test everybody who's asymptomatic, it'd probably be higher. I'm not sure that would be good public health at this point. There's not a lot gained by that. In places like New Rochelle, where they've tested thousands of people who are asymptomatic, yes, you have a higher number, 100 plus in Westchester. we really have to focus at this stage on people who are sick, who have real, potentially life-threatening symptoms, who need to be inpatient in hospital. If you are mildly symptomatic, you should be staying at home and you can self-heal. As you mentioned earlier, 80% of people don't get chronic symptoms, and there's no reason for the medical system to be clogged with people who are mildly symptomatic.